Hey, you guys, welcome back. As promised, we're going to do some practice questions, just a few today, on some of the antibiotics that we've been covering over this past month in our series. And I'll continue to do some like this just so that you can see how to apply the information that we've been going over about the actual antibiotics to the topic and different scenarios that you may see on boards and exams as well. Okay. All right, let's get into the material. Question number one states a 42-year-old for me. A 42-year-old female presents to the office today with complaints of pain to the right ear. She states that she has recently had a cold but has been feeling better for the past few days, and now simply her ear hurts. Assessment completed with noted erythematous tympanic membrane. What is the best first line therapy for the nurse practitioner to prescribe? Is it A, augmentin, B, levofloxacin, C, amoxicillin, or D, azithromycin? Take a moment and tell me what you think in the comments. All right, you guys, the stem of the question states, what is the best first line therapy for the nurse practitioner to prescribe? I always recommend reading the stem of the question first, simply because it slows you down and makes sure that you are answering what is even being asked. Sometimes we read a question and we get so caught up in all the things that are included in the scenario that we start to form our own narrative. And sometimes that's not even what they're asking us about. So take a moment, slow down, breathe, read the stem of the question, and then apply the things that you need to answer what it's asking. So it's asking you what is the best first line therapy for the nurse practitioners to prescribe. So if we're thinking treatment, we got to back it up and see what they even have to treat, right? So they complain of this right ear pain. She recently had a cold. She's doing better. Tympanic membrane is erythematous. To me, I would instantly think acute otitis media, just simply because of the otalgia and the redness in the to the tympanic membrane. And she was recently sick. Um, so with this, then I want you to think, how do we treat that? Think assessment, diagnosis, evaluation, and treatment, like I always tell you guys. So you see the symptoms, that's how we assess, right? Then we're starting to diagnose. We came up with acute otitis media, right? The patient, we will evaluate how they're responding and things, but what do we treat? How do we treat this? And this specifically in the stem says the first line therapy. So what is first line therapy for acute otitis media? The answer is C, amoxicillin. In my review book, in my courses, I talk to you guys about this, and my little mnemonics and things, and I call them Brittany's Brilliance. Here I say, think of the A's. A for acute otitis media, A for first line therapy being amoxicillin, A for second line therapy of augmentin, and then 3 azithromycin for that third line therapy. So C, amoxicillin. Next, the second question states the nurse practitioner is assessing her patient who was recently diagnosed with community acquired pneumonia. The patient has a past medical history of diabetes, congestive heart failure, and chronic kidney disease. The patient denies any previous antibiotics. What is the best treatment option for this patient? Is it A, azithromycin, B, doxycycline, C, clarithromycin, or D, levofloxacin? Take a moment and tell me what you think in the comments. All right, the stem of the question states, what is the best treatment option for this patient? So we know that this patient has been diagnosed with community acquired pneumonia. They have a past medical history of diabetes, CHF, and CKD. They haven't been on any antibiotics. So how do we treat community acquired pneumonia, right? So we know first line therapy is macrolide, right? But in this case, I want you to dig a little bit deeper. So diabetes, CHF, CKD, these are comorbidities. So we don't want to just hit them with macrolides. We got to step it up and give them the big guns. They already have a lot of other risk factors. Although they haven't been on antibiotics in the last 30 days or 90 days, they do have significant comorbidities. So you want to go to a respiratory fluoroquinolone. Now, macrolides, are myosin. So you could have eliminated A and B, azithromycin, or C, clarithromycins, because the macrolides we wouldn't do. Now, if they didn't have the comorbidities, it was standard community acquired pneumonia, you would have went with that, right? So the respiratory fluoroquinolone, fluoroquinolones end in floxacin. So your best answer choice is D, levofloxacin. Now, I do want you to remember that, just like I told you in my video, Brittany's Brilliance, in one of the antibiotic videos that we have done this month, when I talked about fluoroquinolones, respiratory fluoroquinolones, there are 3 that we commonly utilize. And I say for Brittany's brilliance, get my lungs, because we're trying to get our lungs together, right? If we're using those respiratory fluoroquinolones, we are working on the lungs. There's a bacteria in that area, right? So get my lungs. Gemafloxacin, moxifloxacin, and levofloxacin. GML. Get my lungs. Okay. So indicator D, the L, and GML, levofloxacin would have been the respiratory fluoroquinolone to bump up for this patient. Okay. All right, and the last question for today is a 24-week pregnant patient presents to the office with complaints of urgency and dysuria. Sorry, y'all, that was a tongue twister. A 24-week pregnant patient presents to the office with complaints of urgency and dysuria. She has completed a urinalysis and it is positive with positive leukocytes and nitrites. What will be the best treatment to prescribe for this patient? Is it A, Bactrim, B, Macrobid, C, doxycycline, or D, provide supportive management only as it is too early in her pregnancy to prescribe any antibiotics? Tell me what you think in the comments. What you got? What you got? All right, so the question states, what would be the best treatment to prescribe for this patient? All right, so this patient has a UTI, urinary tract infection, right? She's 24 weeks pregnant. Pregnant patients with UTI are considered complicated UTIs, right? You know, we have uncomplicated and complicated. We still treat the same. The duration is just longer for the complicated population. Now, which medication do we utilize? Are you going to go with A, Bactrim? And you should eliminate that immediately because what? Bactrim is a sulfa medication and we don't give sulfa meds to the pregnant population, right? All right. B, Macrobid. Ding, 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 ding. Yep, we'll go with Macrobid. Macrobid, also known as nitrofurantoin, first line therapy for urinary tract infections. C, doxycycline. We don't even usually utilize that for the treatment of UTIs, but the key indicator here is doxycycline is a tetracycline. We don't give that to pregnant women either, do we? And then lastly, D, you can eliminate, you can do supportive management, like if they had a fever or something, treating the fever. But you can give the antibiotic to the patient being pregnant. So best answer choice is B, Macrobid. All right, you guys. Hope you found these few questions today helpful. Just wanted to give how we have you know the knowledge and you have it in your mind, but you have to make sure that you know how to take that knowledge and apply it. So I just do these. So my hopes is to be able to help you take this information into small increments, retain it, and then take what you have retained and apply it accordingly so that you can be successful on boards. Okay. So as always, y'all, just like, comment, subscribe, share with whomever you may think finds this beneficial as well. And be sure to meet me back here. If you have any questions or topics or anything that you would like me to cover, post it in the comments. I'm happy to do so. But meet me back here for more questions. We will be doing some more of these on antibiotics. And I will see y'all then. Bye, y'all.